We're well into the countdown to the Informs Conference on Healthcare 2023, which will be held this July 26th through the 28th in beautiful Toronto, Canada. This Informs Conference, held every other year, is the premier healthcare conference that brings together the full spectrum of stakeholders in healthcare analytics to address barriers and challenges facing those on the front lines of healthcare. Today, I'm joined by the co-chairs of the 2023 conference, Dionne Aleman and Mike Carter, to take a look at this year's conference, the field of healthcare analytics, and a special insider's look for attendees at what to see and do while in Toronto, when they aren't attending the conference, of course. Both Dionne and Mike are professors in mechanical and industrial engineering at the University of Toronto, and Dionne is the director of the Medical Operations Research Laboratory, while Mike is the director of the Health Resource Modeling Laboratory. Dionne, Mike, thanks so much for joining me to talk about the upcoming Informs Healthcare Conference.
Thank you, Ashley.
Thank you.
So to start, can you share a little bit about your roles in this year's conference and how you came to be involved?
The Center for Healthcare Engineering. This is something we wanted to do for a long time. At our department, about 15 years ago, we started something called the Center for Healthcare Engineering. We have like a dozen faculty members within the department doing some or all of their research in healthcare, and a large contingent of current and former graduate students. So it's a logical hub for an Informs Healthcare Conference. We've been talking about it for ages, and we decided to toss our hat in the ring a few years ago. And I can't remember if Dionne talked me into it or I talked her into it, but there was a lot of arm twisting going on. I have to say that we then talked Greg Sarek into being program chair, and Dionne and I have been sitting back watching Greg do work miracles and pull together an amazing program. So that's a shout out to Greg.
In addition, University of Toronto is home to 11 affiliated hospitals, some of which rank among the top 10 in the world. So we're hoping to showcase some of the great healthcare that happens here in Toronto and how operations research helps take that healthcare to the next level.
The last healthcare conference was held virtually mid-pandemic in 2021. How does it feel to be returning to an in-person conference this year?
To be honest, we were a little frightened, a little nervous about it a year ago when it started, but also very exciting to see people in person again. You know, the virtual conference, you still get to see the talks, etc., but you don't get the interaction with people. And we believe that the hotel, we've been to a hotel a couple of times, and we believe it's going to be a fairly safe environment. And hopefully we'll all get out of this enriched and healthy.
So in the wake of the pandemic, what are some of the biggest changes you've seen in the field of healthcare analytics?
Well, I would say there's definitely been a spotlight pointed on the quality and availability of healthcare data. Right, as we all know, during the pandemic, we have lots of great tools that we can deploy, many of which can be set up very fast, but the data just wasn't there or wasn't made available. You could get only snippets from here or there, but not necessarily enough to do any deep analysis. So hopefully coming out of the pandemic, there'll be efforts to put into gathering, storing, cleaning data in a way that will allow us to do mathematically inspired decision making really fast and really quick. I think we've also seen that the need to consider equity and access in healthcare has really become important, right? From looking at vaccine rollouts to now availability of healthcare. Again, just spotlight after spotlight on porous aspects of our healthcare world and how we could go about improving them.
I think one of the things too is going to be that, when the pandemic came, operations research, it takes us time to develop models and to do the background work. And we had some, mini pandemics that happened earlier that allowed us to develop some of the tools available. But I think we're going to be a lot more prepared for the next one. And there's going to be another one.
I think we also learned that there's a good balance to be struck between things that are really mathematically novel and intense versus things that can be deployed quickly, right? You need an answer, you need something analytical, you need it fast. You might not have time to put together the world's most intense integer programming problem and solve it, but you do need to be able to come up with something fast. So being able to strike that balance of speed and optimality, I think, has also shown that there's a lot of interesting work to be done in that area.
Now, looking ahead to the 2023 conference, could you tell us a bit about the featured plenary speakers?
We were very lucky to have Matt Anderson as the lead plenary on the Wednesday. And Matt, he's currently the CEO of Ontario Health. And to explain, Ontario Health is sort of an arm's length partner organization with the Ministry of Health. So it's not under the government, it's separate. And it's the policy, it's the design, it's the guidelines, the recommendations, the interface for the ministry. Matt, he started out 25 years ago He was the CIO of the University Health Network, which is the largest hospital network in Canada and one of the top 5 in the world. Since then, he's been the CEO of several hospitals, large hospitals, and now he's the CEO of Ontario Health. He's very much an analytics decision maker, and so he's very keen on the idea of operations research and analytic methods in healthcare. I'm hoping that he's going to tell us about plans to bring Ontario into the 21st century.
We also have Tim Chan, another professor in the Department of Mechanical and Industrial Engineering here at U of T, who's going to be talking about analytics in healthcare and the broad spectrum of topics that can be addressed with analytics and some of the exciting work that he's been doing.
The third plenary speaker, Mohammed Mamdani, he's Vice President of Data Science and Advanced Analytics at Unity Health Network, another large network downtown. And he's the director of the University of Toronto Emerity Faculty Medicine Center for Artificial Intelligence Research and Education in Medicine. Mohammed he's a big believer in AI and healthcare, and that's what he's going to be talking about. He's also sponsoring one of the tours on the Tuesday before the conference. And so we're very pleased to have him talk about some of the applications that they've been doing in AI. I know there's a lot of interest in that in the conference.
Now, what are some of the other topics that attendees will be exploring during the conference?
So, of course, machine learning and data mining analytics are big and growing bigger. So there'll be a lot of that at the conference. But also, very obviously, coming out of COVID, there'll be a lot of talks about public policy, pandemic modeling, health equity and health disparities, global health and humanitarian operations, in addition to our usual frequent healthcare topics like medical decision-making and personalized medicine.
And now, how about networking? Can you describe some of these opportunities that'll be available for 2023 attendees?
We just did a tour of the hotel the other week. One of the things that we're very keen on is to have opportunities and places where people can meet and chat and work. And so we have several rooms set up, and we have tables set up throughout the hallways where people can meet and chat. There'll be a networking lunch on the Thursday to give people an opportunity to get together, and a reception on the Wednesday evenings. We're hoping to have lots of opportunity to get together. I mean, this is it's once every 2 years. In a sense, it's a fairly small community. We already have over 400 presenters giving papers. We're hoping to set a bit of a record in terms of attendance, and we're well on our way to doing that. So
don't jinx it, Mike.
Sorry, yeah, right, yeah.
Additionally, we'll also have a networking lunch on the Thursday of the conference. But as Mike said, really the best way to network and to get to know the people in your community is just to meet up with people and sit down and have a chat here, there, wherever you can find some space. And there will be lots and lots of places for people to just gather together and talk about what they're doing and where they're headed with their work.
So now you touched on one of these earlier, but there are a number of pre-meeting events taking place as well. Could you tell us about these?
One of the newest hospitals in Toronto is the Humber River Hospital. They set out to be a paperless hospital. I'm not sure they entirely succeeded yet, but one of the things, they have a command center in the hospital with one wall that has data on every patient, where they are, what the status is. It's amazing. And it has desks spread around the command center of case managers who are watching individual patients and following up. So one of our tours is for the Humber River Command Center. So that should be really cool. Humber is doing some really neat things with AGVs running around and delivering things instead of porters, etc. So it's a lot of fun. We also have a center called Kite. It developed, and I've been to the center. It has some really neat human factors in healthcare displays. One of them, for example, they built a room where the entire room can be, first of all, flooded with ice and then tilted to see whether boots can actually walk on ice on a slope. And they actually test people. So they have people tied up with a rope so they don't fall, and then they give snowflakes to boots, 1, 2, or 3 snowflakes, depending on how much of an incline they can go up. They've built a whole bunch of things in the basement in the rehab hospital. So it's a lot of fun. It'll be interesting. We also have Mohammed, as I mentioned, at the Unity is going to have people presenting a number of different topics on AI and healthcare. And the fourth one is there's a human factors center at the University Health Network. There's sort of one floor of one of the buildings in the hospital. They've got operating rooms and they've got patient rooms where they can actually simulate people moving through things and watch it and time it and see how nurses do and how doctors do on things. So they're going to be doing a presentation on some of the human factors things. They've developed a lot of apps and tools and things. And then in addition, there's a second one on the same floor looking at operations research applications, analytics applications in healthcare. So they're going to be doing a presentation on some of the things that the University Health Network has developed. So it's quite exciting. We have a number of people. The tours are starting to fill up. So it's really, this all worked out. I'm going to jinx it, aren't I?
You're totally going to jinx it.
I know. Dionne and I just signed up for tours now.
Yeah, walking on ice on a ramp, that reminds me of the first time that I ever went to Ottawa, which was in the winter, and I did not have snow boots. I literally could not walk uphill on any inclined roads. I would give those shoes 0 snowflakes.
Sure. And now you got to know Dionne is Miami based, right, originally. So. Ottawa ice was not normal out of the door, right?
No, it's much more here in Toronto.
As soon as I found out about the center, my wife made me go out and buy 2 snowflake suit boots. Those are pretty good. Anyway.
Well, luckily for attendees, they'll be in Toronto during the summer. What kinds of things can conference attendees see and do during their downtime at the conference?
Well, the Blue Jays will host the Angels, which is located downtown, right next to the CN Tower, right next to Ripley's Aquarium. You could make an entire day or 2-day affair out of just that one little quadrant downtown. Our baseball team is amazing, and the Angels have Mike Trout and Shohei Ohtani. So it'll be the most wholesome and fun group of people out on a baseball field as you'll see all season long. There's also Beer Fest that's happening as well. So it's our Toronto Festival of Beer. Go and drink beer. There's also just food and more food. I mean, Toronto is really a foodie's dream. You name a genre of food, we have it in spades and a very high quality and sometimes even at very low prices.
Toronto is an entertainment hub for North America, sort of somewhat behind New York, but not by far. There are plays and entertainment and shows and live theater all over the place. Theater in the park, at I Park. Outdoor, Royal Ontario Museum is brilliant. Had my grandson down, look at dinosaurs, looking at walking around all kinds of T-Rex examples. So it's great fun. And all within walking distance of the downtowns.
And it will be hot, so make sure you dress accordingly. We do have sun in Canada, so bring your sunblock.
They can leave their snow boots at home for this trip. For folks attending the conference for the first time, what do you recommend they do to get the most out of the experience?
Meet people, right? Find somebody that you're interested in or grab somebody whose talk you saw and just chat them up in the hallways and the big open space around all the meeting rooms. There's lots of places to just grab a coffee and sit and chat. And that's the best way to grow your own horizons and to learn about what's going on. But I would also say to definitely try to go on one of the tours. That way you can really see where the rubber meets the road in terms of what can and is currently being done in the real world in healthcare.
I would agree absolutely that the most critical element of the conference is the individual interactions and meeting people, and especially for young academics, to be able to meet with some of the leaders in the field and then keep in touch with them afterwards. Right, it's a tremendous opportunity. So, and it all happens once every 2 years, right?
It's been probably a long time since a lot of us have been to a conference in person. So now's your chance. Get out there and catch up with old friends and relive old times.
Dionne and Mike, what a pleasure talking with you, and thank you for helping highlight the Informs Conference on Healthcare and sharing some special insight on the beautiful city of Toronto. Do either of you have any final thoughts to add?
Anybody who comes to Toronto, one of the top things to do is to take a side trip and see Niagara Falls, which is there's buses running regularly back and forth, tour buses. So that's kind of fun. Now, that takes 10 minutes. And then the second thing to do is visit the Ontario Wine District. There are hundreds of wineries, literally hundreds of wineries, and it's this valley that produces some very fine wines. Some not so fine too, but there are a few really good ones. and it's award-winning ice wines in particular. It's a lot of fun to spend, on the weekend after the conference in particular. It's a great side trip.
You could take a literal 3-minute ferry ride to go to Toronto Islands, and there's a little theme park there. There's beaches. There's lots of fun walking around and nature and great views of the city skyline as well.
The island is a little over a mile long, and it's just green grass and rolling and restaurants, and it's a lovely way to spend a day.